Welcome to this video. Today we will be discussing the differences between the DSM and the ICD. The DSM, Diagnostic and Statistical Manual of Mental Disorders, and the ICD, International Classification of Diseases, are two major systems used to diagnose mental health conditions, but they differ in important ways. The DSM is published by the American Psychiatric Association and is mostly used in the United States, while the ICD is published by the World Health Organization and is used internationally. The DSM focuses exclusively on mental health disorders, offering detailed criteria for diagnosis, whereas the ICD covers all diseases, including mental and physical illnesses, making it broader in scope. In terms of structure, the DSM tends to be more descriptive, often providing very specific symptom checklists for each disorder, while the ICD is more general and designed to be accessible to a wider range of medical professionals around the world. For example, in the DSM-5, major depressive disorder is a key diagnosis, and it includes very specific criteria like depressed mood for at least 2 weeks. In the ICD-11, a similar condition is listed as depressive episode, but with slightly broader guidelines. There are also disorders with different names between the two manuals. For instance, dissociative identity disorder, DID, in the DSM is known as multiple personality disorder in older ICD versions, and while ICD-11 now uses dissociative identity disorder as well, the differences in history still affect diagnosis globally. Another example is hoarding disorder, which was introduced in the DSM-5 as a standalone disorder, while in the ICD it is still often considered a subtype of obsessive-compulsive or related disorders. Understanding these differences is important because it influences diagnosis, treatment planning, and research. Clinicians using one manual might diagnose differently than someone using the other, which can have real-world effects on care, insurance, and patient understanding.